Hey everyone! Alright, so this video is going to be my birth plan video. A lot of you have been requesting that I just let you guys know what my birth plan actually is for Ewan's birth. And we do have a couple of things in mind that we would really like to have happen. And this whole time I've been saying that I'm going to actually sit down and write it out so that I can take it to the hospital with me. And I'll have a copy, and the nurses will have a copy, and the doctor will have a copy. But I haven't gotten around to it yet, and I am afraid that I'm going to go into labor and I still haven't made my birth plan video. So I'm just going to wing this video a little bit and let you guys know just the few things that Jason and I would really like to have happen at Ewan's birth. We are incredibly flexible with what we would like to have happen. We understand that a lot of the things that we want to have happen are dependent on myself and how I am after birth, how Ewan reacts to birth, if I have a C-section, if I don't. There's so many variables, and we are absolutely understanding of the fact that this is just a plan. It is not an absolute written in stone thing. More than likely there will be something, a hiccup will happen and not everything will be able to get done, but the things that really do mean a lot to us, you know, we just, in any event, this is what we would like to have happen. As far as my actual laboring is concerned, we want to labor at home for as long as possible. I've been practicing my breathing, practicing just positions that are comfortable, and just being comfortable at home. I really don't want to rush into the hospital if I can help it, just because I'm going to be more comfortable at home. And yeah, so we want to labor at home for as long as possible, but if my water breaks, we'll be going right into the hospital, and also, you know, once my contractions get to be 3 to 5 minutes apart, we'll go into the hospital then. But anything before that, I really don't want to go into the hospital, because I'm just going to be more comfortable here. I'd like to labor when I'm at home. I'll be in my bathtub, or I'll be in the shower, you know, just whatever I feel like. I just like being in the water. This whole pregnancy, I've really loved taking baths, and I really love taking showers. Sometimes I'll take up to 3 showers a day just because I really find it comfortable to be in it. So I'm thinking that I'll probably be in the shower and in the bath a lot during labor, which, you know, I think is quite common. But nonetheless, that's what we would like for labor. I don't want a lot of people around. My husband will obviously be around, and my parents will be around, but I don't want visitors other than that while I'm in labor. I'm someone that kind of is reclusive isn't really the right word. I just kind of go into myself a little bit when I'm uncomfortable or when I'm in pain, when I'm sick, so I would just rather it just be Jason. And I even told my mom, you know, because my mom is going to be in the room when Ewan is born, as well as my husband, but I told her that, you know, during labor, that there may be times where I don't even want her to be in the room. And she said that that won't hurt her feelings if I tell her to, you know, leave for a little bit, just because, yeah, I like to be by myself. I like Jason to be there. And I told him things that he can do to help me get through, just rubbing my arms, or, you know, we were shown some techniques at our prenatal classes about how to help with back pain and back labor. So he's been practicing those, and so he's ready to help me. But in any event, limited amount of people while I'm in labor. What else? For the actual for my managing pain while in labor, I am open to pain medication. Ideally, I would like to go natural. Ideally. However, I'm saying that tentatively because I have no idea obviously this is my first child. I have no idea how I'm going to be able to handle the pain, how intense it's going to be. So I'm saying that I'm open to having pain medication, but I would really rather not. I'd really rather not have an epidural. The reason that I don't want an epidural is because I feel like the stuff you have to go through after the baby's born, like especially the catheter, when I have a catheter in, I always get like a UTI afterwards, and I'm just uncomfortable, and so to add like a UTI because of the catheter on top of like possible stitches and just being uncomfortable because I just delivered a baby, if I can avoid that, I really would like to. So that being said, I also don't want narcotics because it can pass to the baby, and if the narcotics are administered like too soon, like too close to the time that he's born, he can be born a little bit slow, a little bit lazy, and then he would have to be monitored. Yeah, and I would just really rather avoid that. But I am open to gas, to having the gas, just because the gas wears off really fast. Like as soon as you stop inhaling the gas, it's like just a couple of minutes before it wears off. So I'm open to trying that, but really for me it's going to be the gas or an epidural. I really don't think that I'm going to have narcotics at all. But again, I'm open, but I just don't see myself doing it. Yeah. Now, I would like it to be natural, if possible, because one of the things that's really important to Jason and I is that the cord is not clamped or cut right away. We would like the cord to stop pulsing before it's clamped and cut. Now the reason for that, we're not saving the cord blood. Where we live, it would actually be like a huge runaround to try to get the cord blood to the people that it needs to get to in time, and it has to be sent away to like a really, anyways, it's a really big runaround. And so since we're not saving the cord blood, I would really like for Ewan to get as much of the blood from the placenta as he can. And so just clamping it, if he's fine and, you know, if he's breathing fine and I'm not hemorrhaging too badly and everything, like perfect scenario, then I want him put up on my chest and I want him to stay there attached, cord, not clamped or cut, until it stops pulsing. So if we have narcotics, that won't be able to happen, and there's other, you know, things that might not be able to happen, and we understand that. But ideally, that's what we would like to have happen. What else? The eye medication that they put in the baby's eyes. Here where we live, I'm not sure what it's like in other places, but here it's mandatory. All babies have to have it. But they don't have to put them in right away. So that first hour or 2 hours after the baby's born, you know, he's going to be alert, he's going to be awake, and that's like crucial bonding time, and so I would really like him to not have the eye stuff put in during that time, because I'd like him to be able to see me, I guess, is my logic. So we're going to ask them to just delay on putting the eye drops in. I think they said that they can wait like 3 or 4 hours and then they could administer it. So we're really going to ask them to do that, and I don't see that being a problem at all. What else? I don't want an episiotomy. Not at all. I would rather tear. I would really, really rather tear than have an episiotomy. So I've made that clear to my regular doctor in case she's the one that delivers me. At my high-risk appointment that I have just this coming week, I'm going to mention it to him as well in case he delivers. That do not cut me. I do not want an episiotomy at all. No, I'd rather tear. So, yeah. I'm hoping that whoever delivers me will be able to coach me a little bit on pushing, you know, when to stop pushing and push slowly, or you know, just guide me through pushing so that I don't tear and they don't need to cut. But yeah, nonetheless. What else? Oh, while I'm at the hospital, while I'm in labor, before I start pushing, but I'm in the hospital, I would like to be in there. They have like jacuzzi tubs. I'd like to labor in the tub if I can. They'll allow you to labor in the tub just so long as your water hasn't broken. But as soon as your water breaks, then you're not allowed to be in the water anymore, which I think is stupid because people have water births all the time. But nonetheless, when your water breaks, they won't allow you to labor in the water. So I'd like to be in the water for as long as possible. Yeah, I think, oh, and if Ewan has to leave the room or leave me for anything, if he has to be monitored, Jason is going to be with him at all times, so Ewan will be with myself or Jason all the time. Just trying to think. I think that's it. I've covered medications that I want or don't want, and yeah, I think that's it. If you have any questions, or if I've forgotten anything, like I said, I'm kind of doing this off the cuff, because I haven't written anything down yet. But yeah, have any questions, absolutely let me know in the comments below, and I'll absolutely answer them. I don't mind. But yeah, that's it for my birth plan. Hopefully things will all go smoothly. Oh, and I should talk about C-section, I guess. C-section is something that I'm mentally preparing for because you never know. Obviously, I'd rather not have a C-section, but I'm not afraid of having a C-section because I know that if I'm having one, it's because I need one because, you know, it's not safe for me or for Ewan for me to deliver vaginally. But really the only thing I'm really concerned about, it's not even the incision, it's the catheter, because the catheter just kills me when I have a catheter in. I'm so uncomfortable for like days after. But yeah, that is it. Questions down below or personal message me if you don't want to leave a comment. But that's it for my birth plan. Alright, talk to you soon. Bye.